How many here at the beginning of the call thought this was AI speaking? At least that was my thinking. So that's the next generation, and that's actually part of what we're going to talk about a lot in the next panel, which is going to be about cyber and innovation. I would like to call our esteemed speakers, Professor Ran Balicer, Chief Innovation Officer and Deputy Director General at Clalit Health Services and Head of the World Health Organization Collaboration Center for Non-Communicable Disease, and a lot of other things that Ran can expand on. Please. Okay, Professor Irad Bengal, Head of the Laboratory of AI, Machine Learning, Business and Data Analytics, LAMBDA, in Tel Aviv University. Liat Nadai Arad, Chief Transformation Officer and Head of I-Medata, AI Center, Tel Aviv Medical Center. Sharon Hendelman Gottlieb, co-founder and CEO of Sheila or Shela Health, depends how you read it. Sharon. And hopefully we'll have Carla joining us. She's actually making her way in right now, so we'll begin, and hopefully she joins us during the panel. Okay, so welcome, ladies and gentlemen. Thank you for being with us today. Let's start with a quick round of introductions. Beyond a few words I said, please just tell us a bit about your organization, yourself, and what you've been doing. We can start with you, Professor Balicer.
Okay, hi, good afternoon, everyone. It's a pleasure to be here today. My name is Ron. I'm a physician by training, with background also in management and informatics. I've been with Clalit for over 15 years. Clalit, for those of you who are not local, is the largest healthcare payer provider in this country that care for over half of the population. Within Clalit, I serve as Deputy Director General, responsible for innovation, research, business development, and academic relations. Beyond that, I have several night jobs to keep life interesting. Most relevant for our discussion today are indeed, you mentioned my work with WHO, but also serving on the UN Secretary General's advisory body, high-level advisory body on AI, that has been working in the last year in order to try and define some of the challenges and opportunities associated with using AI in general. And within that, I'm responsible for some of the healthcare components of that. So I'll stop there.
Thank you. Professor Bengal?
Yes, hi. Yo, Irad, nice to meet and pleasure to see so many people in this specific year, including from abroad. Thank you, all the guys that came a long way. We appreciate it. I'm a researcher at Tel Aviv University. LAMBDA actually tries to bridge the gap between industry and academia in a way that we find interesting problem in the industry, and if they justify, a PhD or a master thesis, then we try to develop a specific solution to that problem. And having said that, some or a few of those ideas were, of course, commercialized, and this is another hat that I'm holding as an entrepreneur and someone that is active in that space. And I must say that along the years, more and more, it became evident that healthcare is taking larger and larger part in AI. It wasn't the focus in the beginning, but nowadays you see that so many problems are coming, knocking on the door. Some of them are related to a specific disease, some of them related to the organization, to the hospitals, and you see that this kind of collaboration led by people from both sides, hospitals, people that are sitting here, and academia, actually provide a very positive outcome. Thank you.
Okay, thank you. Liat?
Hi, good afternoon. So my name is Liat. Until 2 years ago, deep into cybersecurity, I was the commander of the key or largest cyber units of the IDF. In the last year, part of Tel Aviv Medical Center, I am the Chief Transformation Officer, and I lead I-Medata, a group of around 30 very unique individuals in the areas of data science, data engineering, software engineering, product, and we're trying to transform the way the hospital and maybe later other hospitals use data for the benefit of our patients. Basically, through three key pillars. One is forming a data platform, cloud-based data platform. The second is the science part, AI-based decision support systems for clinicians. And the third is applications that don't always need to be AI-based, although it's the sexy word these days, but actually enable the use of large amounts of data to do health otherwise.
Okay, thank you. We'll just welcome Carla, who has made it. Thank you, Carla, for the effort. Carla Wheeler is a former healthcare CISO, and we're just doing the introduction, so you can take 2 minutes. Sharon will introduce, and then we'll be back to you.
Yeah, pardon the sweat. Had a lovely opportunity with the
To see Tel Aviv.
driver, and got to pull out the app to try to speak Hebrew, and that was a very rough experience, but we made it through. We made it through. So Carla Wheeler, thank you all for having me. Other than a fun cab ride, I'm having a blast. I really am. So 3-time healthcare CISO, been a CIO and a CITO, and been in cybersecurity probably for about 15 plus years, though they didn't quite call it cybersecurity back then. But in any case, I am here and ready to partake, and I'll be doing this for a minute. So it's not a hot flash, it's just the heat outside.
Okay, you have a few minutes, and now to you, Sharon.
So hot flashes are over here with women's health, so pleasure. I'll explain in a minute. So it's a pleasure being here, and thank you for having me. I'm Sharon Handelman-Gottlieb. I'm one of the co-founders and the CEO of a startup in the women's health space, hence what I mentioned, the menopause.
Sharon, can you just get the mic to you? Yeah.
Okay, I was ordered to put it down. So I'm the CEO and the co-founder of Sheila Health, which is providing precision health recommendations for women's health conditions and challenges. We're focusing on pregnancy complications at the time being. And we have super advanced AI, which Irad mentioned before, machine learning modules that combine multi-omics layers and biomarkers together with clinical data to provide early prediction and precision for leading pregnancy complications like preeclampsia, gestational diabetes, preterm birth, and other cool things. Thank you for having me.
Amazing. All right, so as you can imagine, we're going to have a lot of AI during this talk, but we will start with classic cyber. So we'll start with you, Liat. So as you said, before getting to the medical sector, you were commander of the cyber unit in 8200, right? I can say 8200 because I said it already, so that's there. But now you're part of the medical...
They'll shoot you, not me. You said it.
Now you're part of the medical ecosystem. So with that perspective, as a newcomer, what are the biggest risks that you identify in the healthcare system with the stakeholders? And probably we'll get to the solutions later, so let's start with the risks.
So we had a live show here right now. I think you can look at two sides of why this is such a huge risk and why what we call the attack surface in the medical world is so big. On one hand, we have humongous amount of users, be it the patients, be it the doctors, be it the call center, and be it the machines. So very, very large amount of endpoints using the systems. 1, 2, uneducated users. Again, as we've seen, we saw a call center, but imagine, you know, the education level of the patients and the doctors, in this specific area. And the third thing is that the systems in healthcare tend to be legacy systems built as Carla said, long before we talked about cybersecurity. So that on one hand, and on the other hand, the potential. The two big risks, one of continuity of care, and the second of breaching personal data are huge risks. So put together those two issues and you have a great reason for attackers to attack healthcare. Just numbers, so I think somebody mentioned before, but between 2022 and 2023, according to the National Directorate of Intelligence in the U.S., a rise in 50%, more than 50% of ransom attacks in healthcare, more than 128% in the United States healthcare. And the reason U.S. is larger and Israel, for example, should be just as worried is that the more you are connected, the more you can be breached. I think that's enough for risks.
Excellent. And that's a great leeway to you, Carla, if you're ready.
Yeah.
So you were actually in the trenches, right?
Yeah.
As a CISO of healthcare organizations, you saw a lot of that. And one of the things that we know is that often you are obliged to allow connectivity to various vendors and medical device providers. So did you actually witness that, and what did you do about it?
Yeah, so to your point, being obliged to the vendors and even to the connectivity, I like to add that, and I'll just speak in regards to the U.S. We have an issue of concern where we have lack of resources, and resources meaning the human resources, where we just don't have enough skilled individuals that are as excited to, I'll say, really get their fingernails dirty in cybersecurity. They want to be in cyber, but they don't want to, I'll say, really do what's needed to know how to be a cybersecurity professional, which really hurts us. So whether it's, being a CISO or even down to the trenches. And then when you start talking about the modality and the tools, we're not able to say, put EDR, any type of intelligence onto those devices. So we're flying blind from that standpoint. So what we try to do to the best of our ability is engage with the vendors to have some type of relationship so we can be a little closer with them to try to collect some of that telemetry, so that we feel better that if they're patching in timely basis, because otherwise the trust and verify just doesn't make us feel as comfortable. And I would say within 2022 and 2023 and even 2024, we've just been getting hammered with various cyber attacks. And then to step back a little further during the COVID period, there was a period of time that we thought that, nonprofits and hospitals would be somewhat immune to cyber attacks, but that quickly went away. So we had to, or try to partner with vendors in trying to bring our arms around that. So those are some of the things we've been dealing with.
Yeah. Okay. So it's clear, from Nate's lecture and from what we're hearing here that our hands are already full, but now AI is coming.
Yeah.
And, it sounds a bit like winter is coming, and it might be in some senses. So Professor Balicer, as you mentioned, you are a member of the advisory team consulting the UN Secretary General on AI, and the committee has already released its interim report. What are the main advantages, and then what are the main challenges you see, and specifically with cybersecurity, when AI comes to the healthcare sector?
Okay, thank you for this. So AI is basically changing everything, right? I think we, as individuals, as workers, we already see some of the impact, but we haven't even begun understanding the true impact that is about to be unleashed on society in general, on everything from work, future of work, to the future of communication, social media. This is only the very beginning. And it's already pretty impressive as it is right now. We see on the level of the UN, it is very clear that the opportunities that are driven by AI in achieving what is called the Sustainable Development Goals, the main goals of the world in trying to improve things like education and healthcare and climate change, etc., would have a lot to benefit from AI implementation in massive scale. And it is obvious that without AI-driven applications, we will not be able to achieve those goals in the foreseeable future. There's not enough money, there's not enough people, there's not enough ability to be able to achieve those, and AI can take us there more quickly and more effectively. That being said, the risks are tremendous as well. And it is very important to understand that there are different kinds of risks that AI pose in a most general sense before going into healthcare. You can think about them this way. Some of the risks are associated with faulty properties of AI used by good people for good practices. So people, for instance, want to use it in healthcare, and what happens is that the AI mimics the training set that is biased, and therefore is leading for a biased outcome. That's an example of somebody who tries to do the best they can. It's just there's a fault embedded in this, or there's hallucinations, etc. The other types of risks are for people using excellent AI, very effective AI, but for rogue purposes. Okay, you take, if we go for healthcare, for instance, somebody can use a perfectly good AI with no hallucinations and use them in order to create a biological weapon. Okay, so that's a risk that we need to take into account, right? When you look at it. So when rogue governments would use AI to do various kinds of surveillance of the population, when terrorist organizations are going to use it in various ways, when people will contaminate social media, that is a problem. And the last kind of risk that we're dealing with is the risk of good people using good AI for good practices, and it goes out of control. And so these are kind of the doomsday AGI, ASI kind of, which I have to say that people are exceedingly worried about those, and these are the least worried, as far as I'm concerned at this point. I am much more worried about the risks to democracy, for instance, from deepfakes than from a superhuman AI that's going to enslave us all. And so these are kind of some of the big chunks of risks we're looking at on the UN level. And the real challenge right now we have is governance. How do we do proper international governance in order to balance the risks and benefit? It's easy to create very limiting governance structures that would hinder dramatically our ability to use AI for good. And that is not going to be useful. And the other way around is to be very lax, and then we will get a lot of the faulty outcomes, and the risks would be materialized definitely. So this game of balance is what we're dealing with in terms of the governance, and reports will be out within a couple of months in the Summit of the Future.
Amazing. Okay, now, so that's from the very high level. Now to the lab. Irad, you're actually working with this model, investigating them in your labs. What do you see? Like, what are some of the, again, risks and maybe some of the solutions to control this beast?
So I think that I totally relate to what Professor Balicer says, and it is at a practical level actually introducing both non-risk and new risk. In terms of old risk that become more risky and effective, of course, is all the issue of cyber devices that are much more granular and much more proximate, even intrusion to people, to the patient bodies. So we see so many sensors now and actuators, so some of them are active, not only as external devices, but also as wearable and even internal devices that can be attacked. And of course, it poses the regular risk of a loss of privacy and even physical damage, but the level is much higher. You can think about, we had a lot of talking lately about a famous patient that had a pacemaker, and of course you can think about way to attack it from remotely. So these are new challenges in old known area. And then there are all those new risks in the area of Gen AI and LLMs that are totally new to us. Ran said very clearly, some of them are simply biased. Some of them can be made easily biased. They can be attacked. Sometimes it's very simple to create a situation where these LLMs, large language model, will generate hallucinations and wrong response. And even if they are used correctly, again, they can produce bias. And it's unlike traditional models, they can even explain, and people will tend to believe it. So it becomes a real risk. And the answer to all these risks is still to keep a human in the loop, someone that will, a physician and professional people in the organization that will have to deal with those new risks.
Yeah, that's a challenge, I would think. The chat GPT is always so confident that you tend to believe it. So now enforcing a person in the loop, that's a challenge on its own account, I think. So Sharon, you're actually trying to innovate healthcare for women, right? But then you have all these concerns, these cybersecurity, like, posing an additional layer on your startup. That's very challenging. So how do you balance that moving forward, but still trying to keep things as secure as you can?
Yeah, well, it's a great question, and I'll just maybe give away some of the background or a few facts. So on the dark web, when you have pricing for a medical record, it's $60. In comparison, when you have a social security number, that's $15, and then credit card number is only $3. So the risk of medical records is super high for numerous reasons. And if you add the layer of complication and complexity to that, it's also even more higher for women's health, especially in the US. The heated discussion or the hot potato discussion around reproductive rights and the medical records and medical information for abortion, pregnancy, and the like are very, very sensitive and are part of the topics of the election. Really, if you hear the elections and what people are rallying around are exactly those. And when you look at that from a women's health startup perspective, you understand that you have both to gain the trust first from the women. Once the ruling, the Supreme Court ruling 2 years ago, really denouncing and undergoing the fact that we women lost the abortion rights or the scrutinizing of that, then startups in my field said, well, what do I do? How do I prove trust to the women? How do I maintain my business? And on the other hand, how do I secure information? So cybersecurity and the infrastructure of data privacy and the like are very important. And when you asked about startups, so yeah, we typically, the way even I introduced myself and my startup, we're super smart, clever, our technology is like the best, but you have to also have the infrastructure and really that foundation, which is the cybersecurity. So it's not about the technology, it's about protecting the technology and ensuring that it's, again, used for the right and best practices, and doesn't reach the wrong hands. So that's kind of the balance that we do. And the way we do that is try to keep it from the starting point into the discussion and having that from a granular way.
Okay, I hope all healthcare startups are as aware as you are, and maybe later you'll give some examples of how you actually implement that. But now to you, Liat, so I-Medata Center, right? It focuses on data. It's not focused on cybersecurity, and yet there are advantages in working correctly with data. So how do these two areas combine? How are you serving cybersecurity while improving the data, handling the data?
Can I just mention something before?
Of course.
I think we haven't said the word education yet in the panel, and also relating to what the talk we saw before. There's a lot of tendency to think about cybersecurity from the technological side, which is correct. But there's another very, very important side, and that's education and the understanding of the different users whoever they are, be it IT people or the personal users, of what are the basic things that they should be aware of. I just want to add that to the table because we're becoming very grim here about all the risks. There are ways to make things better. So yes, I don't do cybersecurity anymore. I had enough of that. But I believe that in what we are doing today, in order to innovate and use AI in the clinical process, you have to organize the data. That's the first thing that we're doing. There's a lot of. It's always fun to talk about what we're doing in the algorithmic AI part, but when I ask myself where my first focus is, it's about getting Tel Aviv Medical Center data organized in a way that we can use it for innovation. And as we do that, that's an opportunity to enable security. When I first came to Tel Aviv Medical Center, it said our data platform is going to be in the cloud. We're putting everything in the cloud. There was a raising of eyebrows. But cloud is now the cloud the way that we're using the cloud. It's not cloud is safer or less safe. The way that we're using the cloud, and since we're building the infrastructure correctly, there's no doubt that it's safer than on-prem 20 years ago systems thrown around the hospital in dark rooms. So I think when we look at the future and we have to use the data properly, there is an opportunity. And the last thing that I'll say, I believe that the future lays ahead a lot of collaboration and data sharing. So Professor Balicer and myself are part of two organizations that if you ask if they are willing to share data today, you'll get a big smile or a great big laugh. And I'm not naive, but my belief is that in 10 years from now, our data will be shared because the data belongs to us as people and not to the hospitals or to the different organizations. And again, that you can look at that as a big risk because if all the information will be shared, there's a big risk in it, but there's also an opportunity to safeguard the data because that's the only way that the people will give us the trust to use the data. So it's a double-sided process.
Interesting. So you're saying because we will need to share, we will have to put extra securities.
I think it was 5 years ago when I went to get my new passport and I was asked to make a biometric passport. And I said, no way. I knew what cybersecurity is about. I'm not giving my identification to our beloved nation. Today, there's no other option because that's the only passport you can get because the understanding is that in order to secure borders, we need this kind of technology. And in order to do that, the secure measures that save our information need to be such that they can be trusted. And I think and hope the same will happen in healthcare. Yeah.
Okay, very good.
That's your business, by the way.
Okay, so now I want to touch on a different kind of innovation, Carla, that you brought up in our earlier discussions, and that is the innovation by hospital staffs, patients, who are being innovative in order to make their lives and the work easier, bringing in devices, application, connecting. That's like a huge headache for a CISO. So what do you do with that?
Yeah, so it touches upon a little bit of AI, but also when you have that, I'll say that creative department. So when you have the research and development, or you have a body of developers within your healthcare system. So in order for us to be able to do that and do that safely, what we had to do, and this is probably not new news for most of you in that audience, we had to basically go through the process of network segmentation. But in order to do that, we had to go through some painful steps. So we had to go through the process of data classification. And in order to do that without a lot of people kicking and screaming, we had to do it in a very collaborative effort so that they wouldn't find back doors on us, so that they would see us kind of marching along together. We also had to do some other cleanup work, such as the access and the access privilege and a little bit of the patching. Once we got to that point, we were able to kind of segment that group into their own little bubble bouncy house to kind of keep them away from everyone else. And then by us using that more or less as a pilot, then we were able to start doing other, I'll say, branches of network segmentation throughout the group. More of a macro layer, and then slowly some micro, but we never got down to a pure micro layer because we wanted to try to get to zero trust, which we never quite got to.
Yeah, well, but it still sounds like a CISO that is trying to enable innovation rather than prevent it.
Yeah,
or stop it.
trying to keep them safe, trying to let them to play with the tools that they needed to, and honestly, we were really trying to keep our eyes on them, but letting them think that they were having it their way.
Excellent. Okay, so now back to AI and cybersecurity. So Professor Balicer, you told us about your work with the UN, but how does Clalit actually harness AI to improve its services, and how do you keep it safe at the same time?
Great point. So let's begin. When we say AI, we mean different things. People have a notion that AI generally means generative AI and LLMs, and that couldn't be farther than the truth. We've been doing AI in healthcare for a decade and a half before the discussion of large language models, foundation models was even on the horizon. And AI begins with simple things, with machine learning, with deep learning that came later. And these are the more ripe technologies that have much fewer ailments as compared to the, let's say, LLMs. Many of the drawbacks that are there, and there's a lot of prior art one can base on in order to ascertain the effectiveness and the safety of each one. Then the metrics to assess those are pretty simple and pretty straightforward to do. So the first and foremost important thing in putting AI into practice is to use what you know how to use. And we've been doing that type of work for a decade and a half at Clalit at scale. So for example, we've been doing predictive modeling for our patients starting 2010, identifying patients that will likely have a disease 5 years from now or 5 days from now, and coming to them in ahead and telling, you look fine, you feel fine, we sense there's something that's going to be potentially wrong, and maybe you want to drop into the clinic to do some checkups just to make sure that's not the case. We've been able to show how we reduce incidence of major chronic diseases. We've been able to show, the most recent publication we had actually in one of the New England journals on AI was to show how, with the use of such AI, we've been able to improve the screening for hepatitis C, which is, hepatitis C is a disease that is very silent when you have it. You don't know you have it. And we've been able to show that the usual screening patterns that we use by guidelines, international guidelines and local guidelines, allow us to, when we screen 50,000 people, we find 38 patients. 50,000 people we screen, we find 38 patients. That's the normal thing that everybody does. But then we said, maybe we can use the capacity we have at the Clalit Research Institute to be able to look at all of our data together as a whole and try to see if we can find hidden patterns in there that would allow us to do better than that. And we have. So that began as an assessment research. And once we saw that was effective, we have put this into practice. And when we put it into practice, we took 500 patients and according to that list, and looked for hepatitis C with them. According to the normal statistic, we should have found maybe one. How many did we find in those 500 patients? 38. That means we have increased our capacity 100-fold. This is not a small incremental change. This is a disruptive order of magnitude, 2 orders of magnitude impact on public health. And so this is just one example of these types of things we've been doing for a while. And there's a whole learning healthcare system happening in Clalit for, as I said, for quite a while. That's why the whole system of a central research institute was started on the first place, in order to be able to, in a safe, very safe environment. Now you asked, how do we keep it safe? The Clalit Research Institute works under actually extreme settings in terms of its privacy and cybersecurity assessment. We have a dedicated team of people that have been qualified to do that undergo continuous checks to make sure that they're, that they're okay. And we have additional security measures put within our systems to make sure that, one hand, we have access to all of the data that we need in order to do our work, and on the other hand, that we are able to do this in a safe and effective way. And so I think that this decade and a half of working this way and zero incidents that we've had, and even near incidents, is suggestive that we're careful enough. Now, people repeatedly tell us, that's very good, but we want to expand some of the access of this to other less controlled environments. We want to do this across the country. We want to share data. So we are now continuously working on ways in which we can gradually increase the circles of access to this data in a safe and effective way by going through much more in-depth anonymization processes and safeguarding the data. And this is something that we are continuously, and we are successful in this. And we are successful in sharing data in a very safe, contained environment, only purely anonymized data. And that actually works, and we are able to have other entities work with us in order to improve public health and clinical medicine through this approach. I hope that answered the question.
Absolutely. And by the way, is this is this something you're imposing on yourself, or is this like something that is demanded by the Ministry of Health? What's driving the security?
I think that these types of the level of meticulousness that we undergo as a Clalit Research Institute goes above and beyond whatever anybody has put forward in any specific general recommendations, and it is actually more severe than other research entities even within Clalit. So we do things that others do not do in order to make sure that we can, on one hand, take the whole gamut of actions because of the role that we have in organization-wide. On the other hand, we can do it in a safe manner. So this is something that is always an ongoing kind of trade-off that we have. So, and we're willing to go through these extra processes and checkups because we want to be able to do all of the types of assessments and studies in a very facilitated, open way that would otherwise not allow us to get our work done.
Excellent. And we'll have more on Clalit later, by the way. I see Aviv is already here. Okay, last two questions. First to you, Irad. Similar question. In terms of the project that you're working, maybe you can give us some colorful examples from the lab on using AI and how it implements cybersecurity.
So some of them are strictly related to cybersecurity, like a work, and quote, I apologize for my co-authors. I won't be able to mention all of them, very good partners, but this was done in collaboration with Yoseftal Hospital, where we actually took, I think, around 30 or 40 devices that are vulnerable to risks, and we actually mapped exactly by actually working with students that are very good in hacking, what are the actual risks that they pose. Some of them are leaking data, some of them can be actually attacked remotely. The focus was ER rooms. Then we had many research along the years that are focused on, I would say, cyber AI and health, not specifically cybersecurity. One of them was with Sharon in her former hat, when we actually took, this app that all of us are now using to navigate through, the HMO options, looking at our lab results and, making appointments and so on. I mean, people design those apps, but then, when you release it, actually, you can look at the data, how people are using that app, and then you discover many, many new things. So you discover that certain people are not using it correctly. Discover that ahead of time, you could know that at a certain age and a certain patient should get a total, a dynamic way of navigating this app. So all this, digital customer journey in the healthcare app was a research that was done. Another work, actually in one of the night job of Ran, when during the coronavirus, we worked with, the Ministry of Health to, if you remember, there was this issue, patient zero, people were actually tracking movement of a specific person. It created a lot of questions. So after a certain time, what we did is actually to take the disease rate and a lot of open information demographically, including information from cellular phone about the way that people travel from area to area, and predict areas that will actually are prone to the next burst of the disease, but on a macro level, not on a micro level, without actually creating any privacy damage to anyone, and many other things. And nowadays we are working a lot. If I want to go back to the way that we started, work a lot on identifying those, we call it inauthentic synchronized campaign in healthcare. They are mostly used now, to affect national resilience or to affect elections. Both usually internally, externally. We saw many such examples in the last war, but they are also very effective to promote narratives that can be very dangerous. For example, against or for vaccination, or creating wrong narrative along the way, and we deal with that, as well as what is called explainable AI, that is extremely problematic when we talk about complex model like the LLMs, and it's very important for people to understand why those LLMs are getting their recommendation, because it's not only a question of someone is working with them wrongly, but some case the target, the objective by which they are working is not so clear for us. So, anytime that you see a doctor and he has to give you some medicine, there is always some kind of a trade-off involved. It can give you a good medicine that will affect your mood. It can actually, many of those, sub-context decisions that physicians are making are not clear to LLM. So, you can get results that are totally focused on the target, but are very deviated from what you mean. There was this example, and by that I will finish, of this Gen AI agent that was asked to minimize by a simulation the number of people that will suffer starvation, through a long period. So the solution was simply to get rid of some of those humans. So you can actually, when you get the integral, you really, less people will suffer starvation. And this is trivial, but many complex questions that are related to the LLM and Gen AI new role as recommendation system to patients will have to be well understood before people follow them, automatically.
Again, the human in the loop, maybe.
The human in the loop, yes.
Okay, and final question goes to you, Sharon, for a couple of minutes, I'm afraid. But we said you are a very aware startup, very aware to cybersecurity risks. What are some of the recommendations, some of the things you implement and you can recommend to other startups in this field?
Sure. So as a startup with a very limited budget, the first recommendation is play it out smartly and integrate it and have it be as part of the system from the beginning. So ask the questions and understand what is needed from a legislation standpoint, from a regulation standpoint, and then build the product, because a good product is not as good if it can't be efficient and effective. And if you have to redo the work, then you've wasted a ton of money and of course a ton of time, and you're not there in the market when you are needed to be there. So that's one. And the second one is do not recreate and reinvent. I mean, go out there, talk to people, understand what is needed, how to make it easier. You mentioned AI. I'm a very big fan of AI. Understand what are the tools there to minimize the cost, to make it easier, again, to play it out smartly with those tools and with those expertise, and understand how to embed encryption, authentication, etc., especially for women's health. Understand what is needed, what is not needed, what you cannot and what you should ask, and then build it in the beginning. And that's, I think, my biggest takeaways when we kind of build and, of course, choose right partners.
Okay, amazing recommendations. And as I said, we at the INCD, Arik and I, working on the healthcare program. This is part of what we are aiming to do to help startups keep their products secure from the ground up, and I'm sure we'll discuss more. So this was a fascinating panel. I think we covered a lot on all levels. I hope you enjoyed it, and I want to thank our panelists. It was great. Thank you so much.